presentation, I'm going to talk about glaucoma. Now, what happens in glaucoma, if you look down to complications here, for some reason, there's increased aqueous humor in the eye, okay, which is like pretty much a closed cavity. So this increase in fluid causes a lot of pressure that can damage the optic nerve, which is cranial nerve 2. So cranial nerve 2 becomes damaged due to the fluid buildup, and the fluid buildup is either due to decreased drainage or increased fluid secretion. The result is increased intraocular pressure. Now, there's two types of glaucoma. Primary open is the most common type, and primary angle closure happens rapidly. Okay, I don't think they have similar signs and symptoms. I don't think it's a big deal for you to try to memorize each one. So I'm just going to give you the lowdown of what's most common. Okay, so the signs and symptoms: tunnel vision. Patients complain of tunnel vision, like they lose their peripheral vision with glaucoma. Okay, their vision becomes blurry, and of course they have decreased vision. They will see rainbow halos around lights, and they may develop reddish eyes. They may complain of an eyebrow headache if the pressure is really high in their eye. Okay, now look at this picture here under signs and symptoms where the peripheral vision is gone. See how it looks like they're in a tunnel? And then also it's blurry on the inside compared to the other picture. Okay. Now the risk factors are the same as most of the other common eye diseases I'm talking about. So advanced age, diabetes, there's a genetic component to glaucoma, hypertension, and retinal detachment. So trauma can also cause glaucoma. Complications, blindness. Okay, so somebody who has glaucoma always has to have extra medicine with them, can never be without their medicine. They have to take it like clockwork, okay? So they have to, if they're going on vacation, they have to plan ahead and make sure they have two bottles of it, two of their prescriptions, because they don't want to get caught somewhere without their medication. All right, so the diagnosis is based on exam. They use a tonometer to measure the pressure. So this is this little machine down here under diagnosis. So that measures the pressure inside the eye, so the intraocular pressure. The normal intraocular pressure is 10 to 21. For open angle glaucoma, it's over 22, and for the closed kind, it is over 30 millimeters of mercury. So that's kind of a difference. The treatment, you can remember the mnemonic STAMP, for put your patient in a supine position. Timolol, those are eye drops. That it's a beta blocker. And one of the side effects of beta blockers are low BP and low heart rate. Okay, there'll be tight bronchioles. So what that means is this medication can cause bronchoconstriction. The other medication is acetazolamide, which is a carbonic anhydrase inhibitor. It is a sulfa drug, so you do need to ask about sulfur allergies with that drug. And this decreases the production of aqueous humor. Mannitol is a osmotic diuretic. We give it for increased intraocular pressure and also increased intracranial pressure. Pilocarpine is a cholinergic, and it constricts the pupil, which helps decrease the flow. Client teaching post-op, prevent increase intracranial increase intraocular pressure. No bending at the waist, no coughing, sneezing, blowing your nose, no vacuuming, no bending at the waist, like if you have to pick something up off the floor, make sure you bend at the knees. Limit head motion. You don't want to increase intraocular pressure by having a lot of activity. Vision is usually better at 4 to 6 weeks, and they should wear medical alert jewelry. Okay, that's it.